when discussing the subject of sexual desire and communication, particularly in a scenario where a woman may be experiencing sexual needs but struggles to communicate them directly to a man. It's important to approach the topic with sensitivity, understanding, and respect for the complexities of human sexuality. 1. Psychological and emotional factors. These include, by a range of psychological and emotional factors, emotional connection. Many women experience sexual desire within the context of emotional intimacy. For some, feelings of affection, trust, and emotional security can be just as important, if not more so, than physical attraction. If a woman feels emotionally distant from her partner, she may have difficulty expressing or experiencing sexual desire. Body image and self-esteem. A woman's self-esteem and body image play a role in how comfortable she feels about sex. If she feels insecure about her appearance or her worthiness of affection, she may hesitate to communicate her desires, even if she wants sexual intimacy. Stress and anxiety. External factors like work, family responsibilities, or personal stress can impact libido. When overwhelmed, a woman may find it difficult to communicate or even recognize her own sexual needs. Cultural and social conditioning. Many women have been socialized to downplay or suppress their sexual needs, viewing them as less important or feeling ashamed of expressing desire. This could make it challenging to speak openly about their desires or needs. 2. Physiological signs of sexual arousal. While women may not always openly express sexual desire verbally, there are physical indicators that can suggest arousal or interest in sex. However, it's important to note that these physiological signs can also occur in non-sexual contexts, such as exercise or arousal due to stress, so they are not definitive proof of sexual desire on their own. Increased heart rate and breathing. Just like men, when women become sexually aroused, their heart rate tends to increase, and their breathing can become heavier or more rapid. Vaginal lubrication. One of the most common physiological signs of sexual arousal in women is the increased production of vaginal lubrication. This typically occurs in response to sexual stimuli, physical touch, verbal cues, or sexual fantasies. Nipple erection. The nipples may become erect or more sensitive during sexual arousal. This can happen in response to touch or visual stimuli, and is often a subtle indicator of sexual interest. Changes in skin tone. The skin, particularly around the chest, face, and neck, may become flushed or redden during sexual arousal due to increased blood flow. This can be a physical sign that a woman is aroused. Muscle tension. As a woman becomes sexually aroused, she may experience muscle tension, particularly in the pelvic area, as the body prepares for sexual activity. 3. Nonverbal cues and body language. In addition to the physiological signs, women may express sexual desire through nonverbal cues or body language. These signals can be subtle but may include physical closeness. A woman who is interested in sexual intimacy may seek out physical closeness, touching her partner more often or positioning herself closer to him. Eye contact. Extended eye contact, combined with a flirtatious smile, can signal sexual attraction. A woman may also use prolonged or intense eye contact to show her interest, flirtation, and playful behavior. She may exhibit flirtatious or teasing behavior, such as playful touches, compliments, or even teasing remarks that hint at desire without directly stating it. Increased sensitivity to touch. If a woman responds positively to light touches or caresses, it could be a sign of arousal. She might lean into the touch or show pleasure in response. Verbal hints. While she may not directly communicate her desire, a woman might drop hints or initiate conversations related to intimacy. This could include discussions about romance, past sexual experiences, or desires in a more indirect manner. 4. How men can be more attuned to these cues. Understanding these signals requires attentiveness and a willingness to respect the woman's boundaries and comfort level. A man can improve his understanding of her needs by being patient and understanding. If a woman is hesitant to communicate her sexual desires, it may be due to fear of rejection, lack of confidence, or uncertainty about the relationship. Showing patience and an open mind can create a safe environment where she feels more comfortable expressing herself. Active listening, being attentive to her nonverbal cues and verbal hints can help a man better understand her desires. Paying attention to her mood, tone of voice, and body language during intimate moments can provide valuable insight. Initiating open communication, creating a space for non-judgmental, honest conversations about sexuality can help. If you find this video helpful, click on the subscription button, like and drop a comment.